Hello, hello. I'm here today with Mey Davidson, known as the Freedom Mummy and a gentle sleep consultant, a mother of two, and we're going to talk about everything about gentle sleep education for parents and how to go about it better and make parents' life better. Yeah, and about your work and how you came to this and what exactly specifically you do. That would be fantastic. Yeah.
Thank you. Thank you for having me here.
Pleasure.
So my name is Mey in long. Mey is short, it's easier. I've been a sleep consultant for 3.5 years. Beforehand, I was a childcare educator for maybe 9 years until I had my second child, and I just decided I just can't do daycare anymore, and it's not something that I see myself doing long term. So I was in a kind of thinking what to do. Do I do totally something different, or maybe go and study to be a teacher, maybe. But the sort of being a teacher was like, no, I don't have enough patience for that. So I just left it at that. And Ray, my second, he was 6 months, and we started struggling with sleep with him. And I got a sleep consultant in, and he was fixed within a week. So
Wow.
yeah, so I was thinking, this is my call. Like that's what I have to do. And then that's it. I started studying, and within a year I had my qualifications. I worked with a few volunteers, and yeah, it was really good and profound and just what I needed. So yeah, that's
Do you do this
basically it.
work online with
I
parents?
do
Yeah.
I do online, but mainly face to face.
Mm-hmm. And
If
whereabouts
it's a
are you?
I live in Box Hill North
In Melbourne?
in Melbourne. But I travel all around. Yeah, I have.
All around Melbourne?
Yeah, so I have far and close. Yeah.
Fantastic. Yeah.
Mm-hmm.
So you kind of mentioned what brought you to this. And it's often the case through our own personal journey, like, me to the naturopath, to being a naturopath through my own personal health journey. And with you and your children, you felt this need and then you decided to help everyone. And you position yourself as a gentle sleep consultant. So because I assume that parents are going to listen to this, and if you have a baby, you know that there are times when we go through sleep issues, right?
Mm-hmm.
Some are less fortunate than others, some are more, and there are different methods, techniques, different schools of thought about how to go about sleep and what to allow, what to not allow during sleep. What do you call
Mm-hmm.
it? Sleep, not education. What do you call it with
Sleep
baby?
training,
Sleep
basically, but
training.
it became a really rude word. Some people, listen, they hear sleep training and they will say, "No, that's cruelty.
Yeah.
So sleep training can be done in different ways, but it's still sleep training. Some people are saying, "Oh, you can't train a baby. They have to grow and learn the skill," which is not true. They have the ability to learn how to self settle gradually without crying by themselves. So
Mm.
some cry will still be presented, but so my transition from I guess mainstream sleep consultant that use not cried out. I never used that. I never thought it's necessary. But maybe control crying, when you sleep train a child, but you outside of the room and you respond to them in intervals. So that was my go-to because that's what I studied. But I felt the need to provide for the gentle mamas, the attachment style parenting and parents out there. And I just felt like I need to change, but also something in me changed with it. And I just I took all my knowledge and more, and I made sure that, so I changed the way I'm responding to the parent. So even though my methods are, well, at the moment I'm only using in the room methods, and I make them even more gentle. Gentler on the baby, gentler on the parent, is because I learned that I can actually take it step by step. I don't have to push the mom, because I know that, within 3 days the baby can sleep, but the mom is not ready for it. It's not my role. It's not my position to put mom in that stress when she's already sleep deprived.
That is
So I learned.
Can I just go back quickly? You said that something changed in you.
Yeah.
What specifically was the change?
I don't know. And I don't know. So it wasn't point in time that I actually went back to do some childcare. That was during COVID, and my husband was a permitted worker, and if I was a permitted worker, my oldest could go back to school, and have some kind of normality. So that's what I did. I just went back to daycare, but it was hard for me to go back to daycare with a young child. And I don't know, like, I just felt sorry for the littlies, that they are there and, not with their mom, or, and I don't know, something in me changed. And I'm like, if I had my time back, I would, I don't know. I would.
You would do it differently?
Not sleep. Yeah, I would do it differently, I guess.
Get it.
But anyway, I guess, I just opened, I don't know, because I'm a mom and I know, my feelings, but I'm not an attached parent. I wanted to be, but it wasn't me. I love my kids and they get all the love in the world, but I'm more like, right, this is the routine, this is what you need to do, and we will work on it. Not attached parent doesn't mean rough and, you don't care about your children.
What is attached parent in your understanding?
Well, in my understanding, it's I guess to be with the child all the time and respond to the child all the time, and while I do that, I also
what age are we
understand I have limits. Well, any age really. So some attachment parents feel like they need to carry their children until their children are happy to be away from them. So there's streams, yeah. So
I'll just shed, a bit of light on that, because I'm kind of a big fan of Neufeld. Probably know of him and the attachment parenting. However, I do not see that extreme, like caring and responding to it, because there is psychological development milestones, and it depends on the age. So if it's an infant, yes, responding to their every need, especially the first 3 months, it is a must. It's the baby is wet, then the baby knows that it cries, and it's going to be dry everywhere, and nice. The baby's hungry, he cries, mom responds. So first 3 months are really, really crucial for that. After, it's a totally different developmental neurological stage. So could be prolonged period of discomfort. So that's how they learn. And it's okay to have a prolonged period, not too long that they give up in despair, but it's okay. And then it's going to be longer. So that's how we develop this. Instead of the older we get, the more we need to be able to cope with the lack of instant gratification. But the first 3 months is this absolute physiological need for that. Yeah.
Yeah.
So
That's why we're not sleep training at this age. We don't do sleep training.
Yeah,
We do sleep settling. Yeah. So even the mainstream, they, we just can't, expect a baby to sleep on their own at that age, not crying or not crying. Some babies will be good and they will go to sleep if you set a routine, but when they're not, it's I'm
glad to hear that even the mainstream school of sleep training
understands
that.
When we study about those milestones and what is developed and what is not yet developed, and the circadian rhythm is not developed until the 4th month. Well, when I studied, the studying said, the books said, yes, we can sleep train at 12 weeks. That's 3 months, but I feel it's still very early. So if mom really, really want to, we will do lots of settling in the cot, or starting the settling on, on the mom, and then gradually transfer the baby to the cot. So by 4 months, by 4 months of age, the baby could actually, fall asleep on their own. But I still take it really gently at those times, because some babies are preemies, it's all, you have to take it all into account.
Absolutely. And what would be an average age of the baby that you attend to normally? At what age moms reach out?
So it's really, I was thinking about it the other day. It's really between 6 months and 10 months, and between 18 months and 2. So in those difficult times, at 6 months, that is like, if you don't have a routine by then, the sleep will be not good. And at 12 months, there is a regression, and they are starting to be toddlers. So there is the manipulation aspect of, of the child, but toddlers are really difficult because they present a whole new, realms of emotions, and the development of the brain is very rapid, and they're starting with nightmares, and they're starting to be scared, and they're starting to talk to more people and be exposed to more people, and that affects it can affect the development, which in that case will affect the sleep as well. So, and it will look like lots of wakefulness, or very stubbornness, to go to sleep at night, no matter what time it is.
Yeah, absolutely. And do you notice that, in all honesty, that especially with toddlers, kind of 18 months to 2 years of age, like if there is no definite routine in the household in general, then it's going to be affecting the sleep. Or it's a very, very settled household, but somehow the child is not sleeping. So what's your experience so far?
Yeah, absolutely. So some like you said, like they have no routine whatsoever. The child is refusing nap because that's very age appropriate, and parents just think that's normal. Okay, they don't need the nap anymore, so they ditch the nap. But then there's too many of awake hours until bedtime. So what happens is, comes, I don't know, 6:30, the child is not ready for sleep. 7 o'clock, the child is not ready for sleep. 8 o'clock, it's too late, So the reason why is because when the child is overtired, the cortisol levels comes up, and these levels prevent the brain from producing melatonin in an efficient way to actually wind the body down when it actually needs to at night, and go to sleep. So the child is wired, and the parents think, oh, she or he is not really tired, I'll wait. And then they wait half an hour, and then, they go into bed, but then the child is awake for another hour or two, So definitely I would, in that case, reintroduce a nap. And if I need to, just do a little bit of changes to the environment. Maybe the environment is to blame,
What
And
specifically, like in the environment, do you think?
for toddlers, I would say white noise is not, if the toddler didn't have white noise up to that point, I wouldn't, you know, I wouldn't say it's too necessary, but definitely dark environment,
Mm,
as dark as can be, and a good, wind down routine before, and persistent with if the child doesn't know how to fall asleep on their own, just being consistent with the sleep training, with sleep training technique, um, and be consistent for a few days.
mm.
Yeah.
Yeah. And I can see how it could be beneficial for a parent, for mum, to work with you, because especially if you go to their home and
Yeah.
you can assess what's happening and kind of give very, very specific recommendations. Is that correct?
Yeah, absolutely. So a lot of the time, if it's a first time parent, and I feel like you know, some parents are really assertive. I know that I need the plan in front of my eyes,
Mm-hmm.
and that's it. I'll do it, and I'm happy to go ahead. I know I can be successful online because I've been through. I worked through COVID, so,
Yeah.
and back then it was 100% success. And then, if the mom feels like she's unsure, she has many questions, she's a bit worried, she's a bit anxious, I would suggest maybe at least the up to 3 hours. That's the first package. Up to 3 hours of home consultation. But it really is
Yeah.
up to the parent. The final decision will be of the parent. I never push my
Yeah.
you
And
know
I mean, what I meant by you going into their house, and it could be through the web camera, really, because I work
I
with
do
breathing
that.
online, and I can pick up
Mm.
things. I can pick up the muscle work, when you're really
Yeah, right.
trained. So you can really see and assess the situation through, if you just show you around.
Absolutely.
Yeah,
Yeah,
absolutely.
and I'm doing that too. So
Yeah.
I had parents, were they not a Chuka. I can't remember.
Some
Maybe it
country,
was a Chuka.
Victoria.
Some kind, yeah,
Yeah.
country. So obviously it's just hard to get, but yeah.
Yeah.
So we did that was recently. Yeah, we did a Zoom consultation, and I was with them until the baby was happy
Yeah,
to
beautiful.
fall asleep. And yeah,
Mm. And I
yeah.
also wanted to ask what your experience is. Like, I work with babies, infants, children of all ages, and what I have to do is to talk extensively, especially if it's young children up to the age of 17, to the mother, because the first, they're gain developmental stages, and there are like 7-year cycles. And the first 7 years, they're supposed to be in the mother's energy. Then the father figure kind of comes a little bit
Yeah,
and
I read
starts.
a lot about that. Yeah.
Yeah. So, and the emotional state of the mother affects so much. Like, I see, health concerns, sleep as well, but not like in terms of sleep training, but
Training.
something, nightmares, for example. And there are specific flower essences, homeopathics, that help really, really well. And we talk about, and it's not like I can take away the stress of the mother, like financial stress or relationship stress that they go through with young children around. However, it's just helping them to cope, to find ways to deal with that and strengthen their own kind of core, their own attitude to life, really. It's like
Yeah.
basic life coaching sort of thing.
Yeah.
And yeah, and the eczema goes away sometimes, and things, and cough stops, just when mum starts to look after. So it's more working with mum, for me sometimes, than just giving herbs or whatever to the child. And with sleep, I would think that would be very, very similar.
Very similar. So it's almost always, if it's a first time mum, although, I've been in the weekend, I've been to a mum of 3 girls, um, and she's still stressed because she's not sleeping. But anyway, first time mums, and we talked about sleep school with me and that mum because that was her go-to. It wasn't for her, but we talked about how sleep school have a good position in this world for mothers that are suffering from insomnia, postnatal depression. They just need someone to take the baby, teach them how to sleep, and bring them back to them so they can be well rested. So this is very extreme. What I do, I do try and educate families to notice how they feel when they going into the sleep training. But I am also asking if they have help around them, if they have support. And I am trying to remember to ask if they suffer from postnatal depression or, so I will know how to approach any situation. But help from a partner, from a family member, friend is very, at some cases I also say it's not worth it's not worth your money if you're not going to be successful, and you're not going to be successful if you're not looking after yourself and being calmer or more relaxed.
Absolutely.
And in other cases,
time out and then going back to the same environment. Is it what you mean?
No, okay. I don't know. This is, do you mean sleep school?
Yeah.
Do you mean a sleep school? No. Yeah, sleep school is different because they do have one size fits all, method, and it's not always, what the specific parent and child needs. So when they're coming back home, it's all going out the window.
Yeah.
It's not practical. So I guess
kind of similar to what I wanted to say as well, but I thought along the line that so they have a rest assuming that they don't have any support network, and they want this desperately. And I can get it. However, the child goes through certain things and then they come back and it's the same lack of support network and stress again. And
that's it. So it's just a matter of time until mom will be, and that's where you come into the picture. You have to help, mom. But in sleep training aspect is really about getting the whole, I'm going holistically when I'm doing a sleep consultation, a sleep plan. So I'm looking at the whole of baby life and family. So if there's siblings, what their schedule looks like, so mom and dad can actually navigate the baby's schedule to take the pressure off. I won't just say, well, this is what will work for you and you have to work around it. No, it's just not like that in life. You have to. So if I want my clients to be successful, because I want to be successful, I have to make sure that I'm taking their whole life into consideration, and that, I guess, alleviates the pressure, alleviates the stress of sleep training, because it is a stressful time. But I always say, give it a week. Give me a week of your all, and you'll see the results, and you will want to continue. So
how fantastic is that? How fantastic is that?
And other times,
go.
At other times, in that aspect, when I'm coming to see the parent, and some parents are anxious, I always say, like, watch your stress levels. When you go in, like, try to be calm. Baby won't be calm if you're not going to be. So sometimes it helps, and sometimes it's not.
I forgot to ask, how old is your older one and youngest?
My oldest is nearly 11.
Yeah.
She's
So
going to
you've
be
kind
11
of
in
been
November.
through this first 7-year cycle. You're in the midst of the second one, and kind
The
of
second one. She's
yeah,
5 and a bit. Yeah.
yeah, yeah. And yes, we definitely notice how they're like sponges, aren't they? And they can read this energy in the house.
Oh,
They don't need
it's
to hear the
crazy.
words. Yeah. They
They
read the
don't.
mood very quickly like this, right? So I'm through 3 7-year cycles now with my older one.
Oh, wow.
So, and nearly 2 with the younger one. So yes, I'm kind of in a different stage of life to
Age. Yeah.
you. But yeah, definitely they don't need words. They read the energy, and the calmer the mom, the calmer the dad.
Yeah, for sure.
Everyone is calmer, even animals, they pick up the same thing. So the
Oh,
whole
yes.
household is
Yeah,
going to be
for sure.
affected. Yes, so important. And that's, the analogy of the oxygen mask for the
Yes, that's
mum,
true. Yeah.
put on yourself first. I know that you love your child very, very dearly, but you really need to look after yourself. And
Yeah.
that's why I actually started. I started last year interviewing different people in the health industry mostly, and self-development. And because I work with children, I kind of, wanted to talk to you as well, because this is like, you are the support network. I don't know how about you, but my clients, like, I love all of my clients very, very dearly. And sometimes I get messages like in a couple of years later, sometimes a photo, and it's just lovely because
Yeah.
I want them to know that they can reach out. If they
Yeah.
just want to
Yeah.
talk, they can just send me a text or send me an email, and know that someone will listen on the other side.
Yeah. That's it. My greeting message in Instagram says exactly that. Once you follow me, I'm saying thanks for the follow. If you have any sleep problems and you want to talk about it, or if you want to talk about anything in the world, like, I'm here.
Yeah.
Yeah. It is important to stay, available for people, not just taking their money. That's how I see it.
Absolutely. Yeah. So beautiful.
And all of my clients will tell you that they can call me anytime, even when we finish, within reason, obviously. If it's just a small question, I'm always there, because you never know, and I've been in that situation when I had only one question, but I've been referred to the website of, click the button and ask the question. Like, I couldn't just text it. And the button cost like $70, or $80, I can't remember. I just feel like it's not fair. If it's just if it's a question that you can answer in a few words, a few sentences, why not?
Yeah.
Make
And it's a human
someone happy.
connection. Absolutely.
That's what's
like,
the
we all
most
have
important.
boundaries, even with friends and family. That's
it.
Yes.
Yeah,
Goes without
but you're right.
saying.
It's the human connection. That's the most important thing.
Yeah, but sometimes, especially with young moms, and they just, at their wits end and don't know where to go, and there is a medical system that's a bit broken. Yeah, let's be honest.
Oh yeah. Yeah.
And
No,
just
true.
reaching out and hearing that it's going to be okay, that there is help, or you're doing well considering, and just to hear that is a lot normally.
Absolutely. Yeah, we've all been there.
We've all been there. Yeah.
Mm.
So beautiful. So I just wanted to let people know where they can find you. Can you tell us the exact name on Instagram or the website?
Yes.
I'm going to pop it in the comments anyway. But
it will be simple: Freedom Mommy Sleep Consultant, or Freedom Mommy Sleep, and then it will show up.
Okay, cool. So you're mostly on Instagram.
Instagram, yeah. Or Facebook.
Okay.
Oh, my website is also Freedom.
Yeah, fantastic. There is a bit of a frozen moment. I'll offer you the opportunity to share something at the very end, or if you complete, that's good too.
No, I think I'm content.
Yeah,
we had a good chat.
It was real pleasure to talk to you. I know that
Thank you
we
so
tried to
much.
reschedule many times, and it's really, really good to connect. And I love how you work and how you help so many women. It's amazing. Women need to support women. We need that.
Absolutely.
We need
For
that. So
sure.
thank you so much for your work.
Thank
And
you.
we'll
Thanks for
keep in
the
touch.
opportunity.
Beautiful. Thanks, Mey.
Right, thank you. Bye.